This is a dressing change using sterile gloves and your sterile kit. Your first situation is a patient who has an old dressing on. You come in, you put on your non-sterile gloves, which came from this box, and you get ready. Of course, you've introduced yourself and you've washed your hands. Good morning, Mr. Jones. I'm going to change your dressing.
Okay, now in your kit, you're going to have your red bag and your gloves, but in real life, that would not be the case. Okay,
So we have the bag out already. The dressing is going to be removed and it's going to be assessed for any drainage, any odor.
And you also should take a look at how many dressings are on, because that's basically what you're going to need.
And I'm taking the dressing off and I'm putting it in the inside of my glove. I'm taking the next one off and putting it in the inside of this glove. And then I'm going to go and wash my hands again in between before I get to the next part. That's done. We're ready for the next part. The next part is going to include use of sterile gloves, which we've taken out of the kit, and we're opening them up. And it says thumb on left, thumb on right. The packaging is such that I can hold it by the 1-inch border, and then I'm going to open them up. And now I'm ready to put on my sterile gloves.
First, we have to open the package.
And we're going to open the package, thank you. So now we're going to open the package and set up our sterile field. So we're going to open the first one away, and the next one
on the other side.
On the other side. And keep your 1-inch border.
And make sure you don't touch the sterile field that you have your gloves on.
Okay.
And you'll notice in your kit there is a sterile field. You may or may not have this in the real world. Okay. So we have an inch border, so we can take just a little piece of it. Okay, and this you would always put the plastic side down. And in this case, since we have a sterile field here, we might want to just use that next to the wound to catch any drainage. This wound has sutures in it, so it's not going to be cleaned because most of the time you have to keep sutures dry.
Okay.
Okay, so now let's look what's in our kit. We do have dressings. We do have roller dressings, which we don't need. We want to get our tape ready. The tape is in the kit, but most of the time tape comes separately also. Okay, so now that we have everything ready, we can put our sterile gloves on, because sterile only touches sterile.
So I'm going to pick up with my non-dominant hand the glove of my dominant hand. I'm right-handed. My right hand is my dominant hand.
Okay, so you make sure you only touch the inside of the sterile glove. Now the next step is very important. You pick up under the cuff
Of the next glove.
and then you make sure before you put your hand in, that your thumb is out of the way so that you could put the glove on without touching the outside of the sterile glove. Okay, you can fix your gloves by touching the outside only, because sterile only touches sterile. Okay, so now you're ready to take your...
This inside was sterile, so I can move it over. This inside is sterile, so I can move that over.
Okay, so now you're going to take your dressing.
Take everything out. We're not cleaning with sterile technique, but we're going to put the dressing on. I'm just going to put it
Okay,
on.
now
If we had a dressing that we had to open, we would have opened it before we put our sterile gloves on. So you can just pop it out, open the dressing,
these things.
and pop it out into the field, okay? So take another one, put it here, and have this.
Okay, so you're gonna open the flaps and you're gonna drop it on your sterile field.
Okay.
Okay?
So the next step is to put the dressing on the hand that moves. We want to make sure that we don't contaminate anything, so I'm just going to move it and drop it on. If this hand is over the patient's wound and it's less sterile, it's still sterile, but sometimes we can use the transfer method where we transfer from the sterile field onto on the bottom, holding it and putting it on top. And then pretty much that's the part that we want to remain sterile. We could wrap.
Yep.
Or just dry sterile. We're going to use the combine. So we'll use the combine where we have the blue side up. We're going to put it down, and then we would tape it, and we're going to use what we call the window pane method.
Now, once the wound is covered, we don't have to worry about sterility. The tape does not have to be sterile, even though it comes in your kit. It could come on its own, like this tape. And you want to make a window pane, and you want to just have the edges
Long enough so that you can turn it up.
so the next person, when they come to remove it, will have a little ledge to remove it. And before you put the next tape on, what you should do is date it, time it, and initial it. We don't have a pen, right?
Okay, so I would put
The last tape.
and I'm going to put my initials. The date is 10/8/15 and it's 3 p.m. and that's going to go over here, and there was one more window pane. Okay, and then you're done.
I have a question that the students might ask. How do you prevent the tape from sticking onto the gloves? Is there a particular technique for that?
No, there
because
isn't, and you
most of the
can
tape is paper.
remove your glove before putting the tape on,
You
because
can.
everything is covered and sterile, so you don't
Right.
have to worry about it.
That's right. Okay, very good. That's it.